So good day everyone, I am Janice alay-ay from North Valley College Foundation Incorporated, taking up Bachelor of Science in Nursing Section A. So we're back again for another return demonstration of male urinary catheterization. So urinary catheterization is the insertion of tube or the flexible tube or catheter into the penis and connect it into the urinary bladder. So, urinary catheterization is usually used to a patient that is having difficulty in urinating. So, prior to the conduct of this procedure, I already checked the doctor's order for me to be able to know that I have the right patient and the right procedure to be done. And also, I already performed a hand washing. This is to lessen the spread of microorganisms and contamination. And also, I already secure all the necessary equipments that I'll be using in this procedure. So, I have here a urinary bag, the two-way full-length catheter, and my catheterization set. So, without further ado, let's get started. Good morning, sir. I am Janice alay-ay, and I will be your student nurse for today. So, may I see your response, sir? Okay. Can you please state your complete name? Okay, and then your birthday. Thank you so much. So we understand that you're having difficulty in urinating. That's why Dr. Jones ordered for you to have a urinary catheterization. So in this procedure, I will be inserting a tube on your penis and connect it into your urinary bladder for you to be able to excrete your urine. And also, in this procedure, I'll be exposing some of your genital area, and this is a little bit uncomfortable. So, is it okay with you, sir? Okay, thank you so much. Do you have any questions or clarification regarding with the procedure? Okay. I also want you to know, sir, that this procedure is maybe painful. Not maybe, but it is painful rather. But don't you worry, because after the procedure, you will be getting relief. Okay, sir, is it okay if I close the windows and curtains for you to be able to have the privacy? Okay. So now let's proceed to the procedure. So the first thing that we're going to do is to position the patient in dorsal recumbent with knee flex. This is to provide good visualization upon doing the procedure. Can you, yes, thank you so much. And then the next thing that we're going to do is to secure the urine bag on beside the patient's bed frame. And then after that, drape the patient, exposing only the area to be used. This is to provide a this is to avoid getting embarrassed and having chills upon inserting the catheter. So, sir, I am now exposing your genital area. So, is it okay? Okay, thank you so much. Okay. So, I have already put the pad underneath the patient. This is to protect. So, the pad will protect the bed linen from getting soiled. So, the next thing that I am going to do is to provide a direct light for the patients. This is to provide a good visualization upon doing the procedure. And then the next thing that I am gonna do is I will open my catheterization set and arrange it accordingly for convenience and maintain sterility. So I'll put the catheter inside my tray. So inside my catheterization tray, I have a sterile gloves, a lubricant, a 10 prefilled syringe containing of 10 cc of water, a sterile forceps, the eye sheets, the cotton balls, and this basin. And then the next thing that I am going to do is to clean the genital area of the patient. So I'll be using this sterile forceps to pick a cotton balls that is soaked with a cleansing solution to clean the genital area of the patient. So the first thing that we are going to do is to clean the genital area of the patient clockwise, and then discard, and then pick another cotton balls clockwise. Okay, then discard, and then pick another one. Do the same thing but counterclockwise. Okay. So dispose the used materials properly. This is to maintain the surface. This is to maintain the sterility of the surface. And then the next thing that I am going to do is to wash my hand. Okay. And then don gloves. Okay. After donning gloves, I will be putting this on the disposable bin, and then put a eye sheet. And then the next thing that I am going to do is to connect the catheter with a prefilled syringe containing of 10 cc of water. Then lubricate the catheter for about 1.5 inches. This will reduce the discomfort and friction upon the easy insertion of the catheter. And then the next thing that we are going to do is to insert the catheter on the penis. So sir, I will be now inserting the catheter on your penis. So just be relaxed and take a deep breath. Okay. So insert the catheter for about 2 to 3 inches, or until the urine will flow out. Okay, so I can see now the urine. And the next thing that we're going to do is to connect the catheter into the urinary bag or the urine bag. And after that, inflate the balloon. So the balloon will prevent the catheter from slipping out throughout the parts of the body. Okay. And then the next thing that we should do is to remove the eye sheets. And also be removing my gloves. And sanitize my hand. And put a tape on the abdomen of the patient. And then cover the patient. So I'll be now exposing, or I'll be disposing the used materials properly. So the next thing that we're going to do is to remove the catheter from the penis of the patient. So upon removing the catheter, so the first thing that we're going to do is to stick into the doctor's order upon removing the catheter for us to know if it is ready to now ready to remove the catheter. So in removing the catheter, the first thing that we should do is to get another type of syringe, because the other syringe that is being used in this procedure will not be used again because that is contaminated, and we should use another syringe because that is for single use only. So I have here another type of tray. So the first thing that we should do is to deflate the balloon. Okay. And then easy pull the catheter. Okay. Then dispose the catheter together with the urine bag properly. And sanitize my hand. And then cover the patient. And then let's have the documentation. So in documentation, we have to include the date and the time of the procedure. We have also to include the equipment that is being used, the type. So I used the Full-A catheter, size 16, and a prefilled syringe containing of 10 cc of water, and also include in the documentation the response and the reaction of the patient, and also the significance of the observation. So thank you, sir, for your cooperation, and thank you everyone for watching. I hope you all learned from it. Thank you and have a nice day.